Stephanie Duquette, a third-year medical student at McMaster University's Waterloo campus, and I'm here at Waterloo Sports Medicine on elective with Dr. Bob Lee to learn about spondylolysis and some home exercises you can do to strengthen your core and help manage your low back pain. So what is spondylolysis and spondylolisthesis? These are injuries most commonly seen in young dancers, football players, and gymnasts. Let's first review some anatomy. Imagine the spinal column, with each vertebrae stacked on one another, cushioned by the intervertebral discs. Each vertebrae articulates with the one above it and below it through the facet joints, which allow motion in the spine through flexion and extension. In between the top and bottom facet joint of each vertebrae is a bony bridge called the pars intra-articularis. Repetitive strain or loading of the spine in extension puts stress on this area, which can cause a stress response to form within the bone. Continued aggravating activities can result in a stress fracture of the pars intra-articularis, and this is referred to as spondylolysis. Without proper rest and rehabilitation, this can progress to a spondylolisthesis, where bilateral weakness in the pars intra-articularis can lead to instability in the spine, causing the vertebrae to shift forward. Physiotherapy is central to the management of spondylolysis and spondylolisthesis. My physiotherapist Alex is going to show me exercises I can do at home to strengthen my core.
Pull your belly button down towards your spine and up. Good, and hold.
She starts by getting me to activate my core in a brace position.
Good, and relax.
It's important to keep this position through each exercise to protect the
Here, turn
spine.
your core on again. Push through your feet, lift your bum up off the floor, creating a straight line with your body. Don't go too far.
With each exercise, she corrects my technique to make sure I'm keeping my core activated.
Okay, progression to this, you're going to contract that muscle again. And you're going to lift this foot just a couple inches off the floor.
You can make these more difficult by adding in leg lifts or knee extensions.
And I don't want you to twist it all through your pelvis. Down. And the other side. Good. And down.
Next, she shows me the proper technique for doing a plank by keeping my spine in a neutral position.
Good. Making sure not to sink your back or raise your bum.
You can add difficulty here by going up to your feet or by using a ball. To activate rotational muscles in my core, she shows me the dead bug by extending my leg out and my arm back.
Good.
If you are pain-free with this exercise, you can progress to partial weight bearing with the bird dog,
Making sure not to arch through your back. Back and the other side.
or the bear crawl. With each of these exercises, they correct my technique to make sure my spine is in the right position to activate my core muscles. If you're able to do these exercises pain-free, then the next step is to do exercises with partial weight bearing on the spine. My physiotherapist Kyle shows me how to maintain proper posture while strengthening rotational muscles in my core using TheraBand by extending my arms forward in the Palloff press, then moving diagonally across my body with the chop.
Turn through your shoulders a bit, but otherwise not rotate.
And then the lift. Before return to sport, you'll need to progress to full weight bearing exercises. It's important to learn proper technique through all planes of movement with your physiotherapist to make sure you're maintaining a neutral position in your spine and continue to use your core muscles. Doing sport-specific movements with your physiotherapist will be important for preventing further injury in the future.
So try and tuck your chin a little bit. Good. Pull your ribs kind of down towards your spine. Good, nice.
If you've been diagnosed with a spondylolysis, your doctor may recommend a back brace for added support during physiotherapy and rest from sport for a period of time to allow the bone to heal. So the take-home message is that improving your core strength is one of the most important things you can do to rehabilitate an injury like spondylolysis. Proper technique with each exercise will ensure that you're strengthening the right muscles. Make sure that you're pain-free before progressing to more difficult exercises, and consult a physiotherapist for sport-specific movement to help prevent further injury in the future.